Okay, there are four parts to Medicare, and you can see all four of them here with Medicare Parts A, B, D, and also Medicare Supplement or Medigap insurance. Part A and B are what makes up original Medicare. Part A is your hospital insurance, and it helps cover you for inpatient care at the hospital, skilled nursing care, hospice care, and home health care. Part B is your medical insurance, and it helps cover you for services from your doctor, healthcare providers, outpatient care, home health care, durable medical equipment, and some preventive services. So basically, Part A pays for your room and board at the hospital, and Part B pays for your doctors and their services. The next major part of Medicare is Medicare Part D, or Medicare prescription drug coverage. Medicare Part D helps cover the cost of prescription drugs. Medicare Part D plans are run by Medicare-approved private insurance companies, and you pay a premium to lower the cost of your prescription drugs. The last part of Medicare is Medicare Supplement or Medigap insurance. Medicare Supplement insurance works alongside Medicare Parts A and B and is designed to fill some to all the gaps of original Medicare depending on which plan you choose. These plans are offered by private insurance companies. Now, if you've not already done some research, you may have heard about Medicare Part C or Medicare Advantage plans as well. Medicare Advantage is an alternative to original Medicare with the supplement, and it is also run by Medicare-approved private insurance companies. Medicare Advantage or Part C plans replace Medicare Parts A and B with a private insurance plan, and it must at least cover what Medicare Parts A and B cover. Some plans even offer prescription drug coverage along with some other benefits. We will compare going with original Medicare and a supplement to going with Medicare Part C and Medicare Advantage a little later, but let's first look at how to enroll into Medicare and also how much Medicare costs. So the majority of people will enroll into Medicare at 65. If you are collecting Social Security benefits or you have railroad retirement benefits, then you'll be automatically enrolled into Medicare about 3 months before you turn 65. If you do not fall under these two criteria, then you can enroll into Medicare 3 months before and up to 3 months after the month of your 65th birthday. This is considered your initial enrollment period. If you miss your initial enrollment period and still want to sign up for Medicare Parts A and B, then you'll need to wait until general enrollment period. And general enrollment period runs between January 1st and March 31st of each year. If you enroll during general enrollment period, then your coverage will start July 1st of the same year, and you may have to pay a higher Part B premium for late enrollment. Last, there is a special enrollment period. This is for people that are still working past 65 in 3 months, and it gives them an 8-month period where they can sign up for Parts A and B when they finally do retire. And this is usually without penalty. Now, when you are ready to enroll into Medicare, either at 65 or when you finally do retire, all you need to do is go to your local Social Security office or give Social Security a call. Medicare Part A is usually free as long as you and your spouse paid into Medicare while working, and Part B usually costs $144.60 a month, as long as you make less than $87,000 filing individually or $174,000 filing jointly. If you make more than $87,000 filing individually or $174,000 filing jointly, you'll have to pay more for Medicare Part B. So now let's revisit Medicare Parts A and B and discuss what they cover. Well, actually, it's a lot easier to talk about what they do not cover instead. So again, Part A pays for your room and board at the hospital, and Part B pays for your doctors and their services. Part A and B do not cover long-term care, most dental and eye care, cosmetic surgery, acupuncture, hearing aids, and routine foot care. You'll need to look into other insurance products to cover these benefits. Now, Parts A and B also have some deductibles and copays you need to know about. So Medicare Part A, or the part that pays for your room and board at the hospital, has a deductible for days 1 through 60, 61 through 90, and 91 through 150. And as you can see here, they are $1,408, $352, and $704. It's important to point out that $1,408 deductible is per 60-day benefit period. So you can end up having to pay for it more than one time a year if you are admitted into the hospital at least 60 days apart. Now, Medicare does cover your first 20 days in skilled nursing care if you get into a facility within 30 days of admission into the hospital. But you must pay $176 a day for days 21 through 100. Medicare does not cover you over 151 days in the hospital or 100 days in the nursing facility. Okay, next up is Medicare Part B, or the part that pays for your doctors and their services. Now, you'll need to pay a $198 deductible before Medicare's 80/20 coinsurance kicks in. Let's go straight to an example. Let's say you have a doctor bill for $10,000. You'll have to pay the first $198 or the Part B deductible. Then the $9,802 gets split up with Medicare paying 80% and you paying 20%. So you pay $1,960 plus the $198 deductible, and Medicare would pay $7,841. Medicare also does not pay for Part B excess charges. Excess charges are when a doctor can charge you up to 15% more than what Medicare is willing to pay for a test, visit, or procedure. So basically, that 20% copay can be as high as 35% with some doctors. Lastly, Medicare does not pay for your first 3 pints of blood or anything outside the United States. Okay, let's revisit Medicare Advantage and Medicare Supplements. You should not have both at the same time. So you can either have Parts A, B, and D of Medicare alongside a Medicare Supplement, or you can just have a Medicare Advantage plan, and maybe a drug plan if it's not already included in the Medicare Advantage plan. You'll need to pay for Part B of Medicare, or $144.60 for both of these options. I'm going to go over some of the simple advantages and disadvantages of each. Medicare Advantage plans are lower cost, with their most popular plans having $0 premiums. Most include drug coverage. Most also have some small benefits for hearing, dental, vision, and wellness. The negatives of Medicare Advantage are the networks where you need to see their doctors at their hospitals. Medicare Advantage plans can have max out-of-pockets of up to $6,700, and these plans are not standardized and can change year to year. Medicare Advantage plans are much more expensive in the long run for chronic conditions, and some HMO-style plans require pre-approval. Medicare Supplement plans, on the other hand, have predictable costs. They are standardized, so they do not change year to year. They also do not have networks, so you can go to any doctor or hospital in the United States as long as they take Medicare business. And Medicare Supplement plans cover some to all the gaps in Medicare. Lastly, Medicare Supplement plans are guaranteed renewable, so the plan stays the same for life. The only real negative about Medicare Supplement plans are that you have to pay a premium for them, and these premiums do increase over time. So Medicare Supplement plans are a great option if you can afford the premiums. Medicare Supplement plans are standardized, so all policies offer the same basic benefits. And it is important to understand that different insurance companies charge different premiums for the exact same policy. Here are all 11 standardized plans. Starting in 2020, plans F and C will no longer be available to people who enroll into Medicare after January 1st, 2020. This is not a big deal to people new to Medicare because both these plans were overpriced anyways. Now, the main 2 plans that are competitive around the U.S. are Plans G and Plan N. Plan G is very easy to understand, with it covering 100% of the gaps in Medicare, with one exception. That exception is that Plan G does not cover your Part B deductible. The Part B deductible in 2020 is $198. So your max out-of-pocket for Medicare-related services for the year with a Plan G would be $198. The next best option, Plan N, is a little more complicated, but it can be a great value. Plan N also does not cover your $198 Part B deductible, much like Plan G, There is also a maximum copay of $20 for office visits and a copay of $50 for emergency room visits that do not result in inpatient admission. Lastly, Plan N does not cover Part B excess charges. Part B excess charges are when a doctor or specialist can charge up to 15% more than what Medicare is willing to pay for a test, surgery, or procedure. Excess charges are pretty rare, but you do need to take them into consideration when making a decision. Monthly premiums for Plan G and N are different from state to state and even for different zip codes. I ran quotes across multiple states and found that on average, Plan G was about $104 a month and Plan N was about $85 a month. And these prices make sense with Plan G having more benefits and costing a little more than Plan N. So make sure to work with an independent agent like myself to run the cost-benefit analysis for both plans. Because like I said before, monthly premiums for Plan G and N are different depending on your zip code. Okay, the last piece of the puzzle we need to cover is Medicare Part D or Medicare prescription drug coverage. It is also run by Medicare-approved private insurance companies, and you pay a premium to lower the cost of your prescription drugs. Now, every plan has a list of covered drugs or a formulary, and these Part D companies can change their formularies each and every year, so it is important to always check to see if you're on the lowest cost plan for the drugs you are currently taking. The best time to check this is during open enrollment period. Open enrollment period runs between October 15th and December 7th of each year. Changing your prescription drug plan during this time will make your new drug plan effective January 1st of the upcoming year. Now let's talk about the most popular pastry in Medicare, the donut. A donut is used to represent how most drug plans work on Part D of Medicare. So before you can get any coinsurance from your drug company, you need to pay up to a $435 yearly deductible. After that, you must pay a co-payment. I use 25% in this example, so you pay 25% of the drug costs, and the prescription drug company pays 75% until you and the insurance company together have paid a total of $4,020. Then you reach the donut hole, or the coverage gap. In this gap, you will be responsible for paying 25% of brand name drugs and 37% of generic drugs. Now, when you have paid a total of $6,350, you move into catastrophic coverage. This is where the government steps in and helps you out. You are then only responsible for 5% of drug costs from this point until the end of the year. Enrolling into Medicare Part D is easy. All you have to do is call Medicare or go to Medicare.gov's website to enroll in a Part D plan. Congratulations, you now know all the basics of Medicare, but in no way did I cover every specific situation or topic of Medicare. So make sure to always read the Medicare and You guidebook each and every year to keep up to date on any changes. If you have any questions or need any help, make sure to give me a call. My number is 920-960-4312. That number again is 920-960-4312, or you can shoot me an email at medicarescreenshare@gmail.com. And always, please like, comment, and subscribe so we can help more people.